Thanks for coming back. Friday the 14th of February. Now these are the current numbers and we are going to be talking about these today to explain a little more. Now before I say anything else, the authorities in Wuhan and Hubei province have been perfectly open about the fact that they are unaware of the true extent of the infection. We'll look at why that is in a minute. But they're quite open about this. They say that these numbers are to the best of their knowledge, but there are many cases that they don't know about. They're quite open about that. And we'll look at possibilities of changes in the numbers. Anyway, current confirmed cases at the moment, 55,476. Now, that's according to the Chinese website I'm using that I've shown you and left links for several times. Do click on it yourself. It's in Chinese, but you can normally see what the numbers mean. I've had it translated, so I do know I'm reporting what that site says accurately. Accumulated confirmed cases, 63,950 since the epidemic began. Suspected cases, another 10,109. And as we've said many times, the Chinese clinicians will now be good at diagnosing this, I'm sure, just clinically. One of the things that's really concerning me is the number of severe cases, 10,204, because these are the ones that are going to need healthcare and professional support. And how many of these severe cases survive will depend entirely, or virtually entirely, on how well they are supported by nurses and doctors in hospitals and all the other support workers we have in hospitals to support this work. For example, when the cases of pneumonia are severe, the patients can become hypoxic, running out of oxygen. They become hypoxemic, low levels of oxygen in the blood, then hypoxic, low levels of oxygen in the tissues. And of course that is a life-threatening situation. And if we can give oxygen support, we can get them over that while we're waiting for them to make the antibodies to combat the infection. Without good healthcare, quite conceivably, many of these will die. Many will also get secondary bacterial infection, which will need antibiotic therapy. My confirmed deaths at the moment, 1,382 confirmed deaths. Now, recovered cases, 7,092. Now, the criteria that the Chinese are using for recovered are fairly exacting. It's improvements in the chest x-ray. It's 2 negative viral swabs on real-time preliminary chain reaction. And it's no fever for, I think, 10 days. So when they say they're recovered, they probably are recovered. That's reasonable. Affected countries, who knows? Basic reproductive numbers, best we know, is still about 2.6, meaning on average, one infected person will infect 2.6 others. Now this R0 number, this basic reproductive number, is not something which is intrinsic to the virus. It's not that one virus has got a particular R0 and another virus like measles has got a high R0. It's not that. It's not something that's scientific about the virus itself. This is related to how many people are actually infected over a period of time in a given epidemic. So good hand hygiene will reduce this figure. Good isolation of infected people will reduce this figure. All of these quarantine mechanisms and things that have been done in China have reduced this figure. So it's sort of a pragmatic guide on how well we're doing, really. But of course, what we need to do is get the R0 below 1. Because even if every infected person is only infecting on average 1.1 other people, then it's still growing. The R0's got to become less than 1 for it to stop growing. Now, I'm no mathematician, but what I've done is I've taken these figures here and just done a few sort of back of the envelope calculations Now, some people watch these videos to spot my gaffes in mathematics, so do feel free to test them yourself. Get your calculator out. But the first figure I've taken there is the number of deaths. That was there. And the total accumulated confirmed cases, that was there. Turn that into a percentage and you get a case fatality rate of 2.2%. So if we accept these figures, the mortality rate is 2.2%. But I've just been listening to Al Jazeera News today, and some experts there are saying it's quite possible that the actual cases are unreported the unreported cases make this figure too small by a factor of 10. That's what some people are saying today. So it could be that the true number of cases is 10 times that. But we probably know that the deaths are this. So if that number there was 10 times higher, and there's 10 times more cases than have actually been reported, which some people think is possible, that will give us that number of cases, 639,500. To turn that into a percentage, that gives us a case fatality rate of 0.2%. So I know which I prefer. So given these figures, some could argue that the case fatality rate is somewhere between 2.2 and 0.2. That's not ludicrous to say that. Now the other thing that could increase that here, for example, that we don't know is well, if I had the choice of where to die, of course I would die at home. Most people choose to die at home, often in hospital practice. If we know someone is in the last days of their life and there's no curative treatment available, and palliative treatment will be available at home through various specialist support services and district nurses, if at all possible, we will discharge that patient home so they can die at home with their loved ones, with their dogs, with their cup of tea, with their familiar surroundings, rather than dying in hospital. And of course, it's the same in China. People prefer to die at home. So the deaths at home from COVID-19 are probably unreported. So, or many are unreported or unrecognised to be caused by COVID-19. So that would make that figure quite a lot higher. So suppose that figure's 3,000. I haven't done the sum, but that would put us sort of more up, sort of in there somewhere, wouldn't it? So somewhere between 0.2 and 2.2 is the mortality, not the mortality, the case fatality rate that we're looking at. But I don't know. This is just trying to make reasonable inferences from the information we have. And likewise, the severe cases. Now, I think we do have a slightly better handle on this, because the severe cases are those treated in hospital in China. And that they're reported at 10,204. And if we do a percentage with the total number of accumulated cases there, that would give us 16% of cases are severe. So if we have 1,000 cases, we'll have 160 severe cases requiring professional care. But there again, if that number, if there's actually 10 times more cases than are officially reported, and that number is actually that number, then that will give us 1.6% of cases being serious. So again, in the same way we don't know quite where the case fatality rate is, in the same way the number of severe cases is going to be somewhere between 16 and 1.6 based on what I can work out at the moment. Now, having said that, there is professional disease modelers do this. If they've got something to say, listen to them rather than my fairly basic thinking on the matter. But that's where that takes us to at the moment. Just give those figures up again. Again, do check these on the relevant website, the John Hopkins site and the Chinese site, where I got those figures. All those figures are from the Chinese site tonight. Now, just finish off with a few, loads of questions. I'm really sorry I can't answer everyone's emails and everyone's comments, because I'm literally getting many thousands a day, and I have to do other things in the day as well as this. So I do answer the ones I can, but I do apologise if I haven't answered yours yet. Right, is hand washing better than alcohol gels? Well, alcohol gels are going to be effective if the alcohol is 70% stronger or more. So it's no good washing your hands in vodka, that's only 40%. These gels are 70%. So they are going to kill the bugs, but they need a bit of contact time. Now, the thing about washing your hands is you wash your hands with soap. I was going to do a video on that, wasn't I? I'll do it shortly. Proper way to wash your hands, all the way we wash your hands. Now, if you wash your hands properly, you get soap all over them. Then what the soap does is the soap dissolves the sebum, this waxy substance on the surface of your skin, the sebum on the surface of your skin. Your skin feels waxy. That's the sebum on the skin. So the bacteria and viruses are stuck onto that sebum. So if you wash that away, then you're physically washing the viruses down the sink. It's a flushing effect. So for me, hand washing in running water is always best. This is one heck of a lot better than nothing, but it's not as good as proper hand washing in running water, dissolving the sebum, physically washing the viruses away. Will the virus weaken as the epidemic goes on? So some people seem to think that the more this virus divides and reproduces, the weaker and weaker it will get. It's not the case. Now, the virus can mutate. There can be mutations in the virus, changes to the RNA in the virus, and that can make the virus weaker. That's possible. But a mutation could make the virus more virulent, or it could make it more transmissible. So the strength, if you like, the virulence and the transmissibility of the virus could change. Or you could get the transmissibility increasing and the virulence decreasing. That's possible. You could have any combination. And it's all just random mutations in the ribonucleic acid. So it could get weaker, it could get less transmissible, it could get less virulent. I really hope it does. But there again, it could become stronger, it could become more virulent, and it could become more transmissible. We are in the hands of the random mutations in the viral RNA. Now, people have pointed out there's a lot of air pollution in China, and that can certainly be true in the cities. Is this a factor? And the answer simply is yes. Air pollution is going to affect all respiratory conditions. Of course it is. We know that correlation studies have shown that people that smoke are more likely to get severe disease. So is it a factor in severe disease? Yes, I'm sure it is. Is it a factor in whether you get it or not in the first place? Probably. Because air pollution is a big factor in pretty well all respiratory disease, as is smoking. So if you do smoke, good time to stop. Because smoking, you're just polluting your own air as you take it in. It's much the same thing in a lot of ways. How seasonal is the novel virus? Now, the novel virus, of course, let's just remind ourselves, is now called SARS coronavirus 2, confusingly. I think I'm just going to stick with this, COVID-19. That's the name of the disease. We call it the COVID-19 virus. It's a completely different thing from the SARS outbreak of 2002-2003. How seasonal is it? Well, this should be on a separate line probably, because this is a bit confusing as well. But SARS-1 in 2002-2003, the epidemic did stop in May or June when the weather got warmer. So the answer's it could do. It depends how like the first SARS virus it is. But there again, the first SARS virus, the epidemic was easier to contain. The spread was easier to contain because even though it was just as transmissible, we knew when people were infected because infective. We knew when people were infective because that's when they were sick. People with SARS-1 were only infective, transmitting onto other people when they were sick. Whereas with the COVID-19 virus, we now know that people are infectious in the in the asymptomatic phase, when they're still incubating the condition. And the fact that it's so prevalent in hot places like Singapore and cases reported in Thailand means I'm more pessimistic about the cold weather killing the COVID-19 virus as opposed to the SARS-1 virus. We know that the SARS-1 virus lasted longest at 4 degrees centigrade on stainless steel surfaces, less time at 20 degrees centigrade and much less time at 40 degrees centigrade. So the SARS-1 was temperature dependent. It didn't like the heat. But the COVID-19 we don't yet know is the answer. We simply don't know. Lots of things we'd like to know. We're working a few bits and bobs out as we go along. But this is still very much an unfolding story, but with potentially global consequences.